I am Dr. Thomas, and today I will be talking about the pink in the mouth, that is the gums. You need to brush your teeth well so that your gums and the tooth doesn't get infected. How do you find gums getting infected? The first sign is little bleeding when you brush. Or when you eat some food, you might get a bleeding from your gums. You might say, oh, it started bleeding, so I am brushing a little more harder. No, it's not because you are brushing harder, it is just because the gum is inflamed. Inflammation is the first sign for a minor infection, because the body is trying to take off the infection from around the tooth. So once you get a small bleeding, make sure that you go to a dentist. You go to a dentist, he will check out whether there is infection around, and he will clean that area using their special instruments called as scalers. Now we have piezoelectric scalers, which are very mild ones, which just vibrates, doesn't cut around the tooth, doesn't make scratches on the tooth. We just go around and clean that tooth area so that gums doesn't get inflamed. Once the inflammation goes down, your bleeding also stops. So that's the first sign for any gum infection. If you don't go to the dentist, you will start bleeding and bleeding. You might have seen smokers who say that I never had any problem in your mouth. They just go and smoking. They don't get any bleeding because the nicotine is a very good styptic. What is a styptic? It stops bleeding. It's not a good thing that it doesn't bleed, it doesn't give you any infection, because you are having enough amount of poison in your mouth that bacteria cannot grow. Yes, I do agree, bacteria cannot grow because you have putting poison in your mouth. Fine. Second thing is, your bleeding doesn't happen even if there is an inflammation. It is good that it doesn't bleed, but it is not good because you are stopping the blood to go. So you don't see the sign, but after some time what will happen? The tooth will start shaking because you have not seen the signs. So in smokers you don't see any sign. Suddenly one day the tooth will start shaking. So in smokers only you will not have any signs of gingivitis. So once the bleeding from the gums starts, you go to a dentist and correct it. If you don't correct it, what will happen? It will become worse and worse. The gum will start receding. What is recession? It is the gum is having irritation so much that gum says, okay, today infection is not going, so I will move out. So infection stays there, the gum goes down. So the infection is solved, bleeding is stopped, the gum slowly goes to a lower level. The gum goes to a lower level, the bone behind it also goes a little lower level. Once it happens day by day, the bone is lost. Once again your tooth starts shaking. So this will happen in a longer time. So what you have to do? You have to do a scaling, regular scaling. We always advise our patients to come every 6 months to have a checkup. Check it up so that if there is a scaling to be done, you can do it. If you don't have to be, doesn't have to be done, don't do it. You just go out. So every 6 months you go and check it up whether there is any gum bleeding anywhere, and do a scaling if required. If it is not required, you can just go out. Second thing what you can do is, whenever you brush, if you feel any bleeding from any spots, please go to the dentist and get it done. See, when you have receded gums, or when your tooth is just popping out a little more than what it was before, what we can do? There are two problems now. The crown which is there outside is cantilevered, or the amount of root which should have gone inside and the outside should have a proportion. So it is just like a lever, or it is just like you are putting a stump on your ground, wherein the how much ever it goes inside the ground, it is stronger, right? And how much ever it is going out, it is looser. So what happens? The gum goes down. It's just like soil erosion. Then the trees will topple after some time. It erodes and erodes, the trees will topple. Just like that, these roots should be covered properly. If you don't have enough amount of root to hold it, better that we cut off the trees. Just like that, you need to reduce the amount of tooth which is outside. You might have to do that, or we need to put back the soil back, right? Just like putting the you need to put the bone back and put the gums back. Two ways of doing it: either reduce the tree, cut the tree to a shorter length, then it will stay, or put the soil back. Putting the soil back, we will just think about putting the soil back. Oh, how is it done? We need to we have artificial bone, we have natural bone which is taken from human beings and processed so that it can be used. Just like you have a kidney transplant or something, we have bone transplants which is from a natural human being and put it there, or you can take it from some other part of your body itself and put it back onto that area, which is a elaborate procedure. If you need a lot of bone, then that is the best thing. But if it is a smaller bone, we can get human bone itself, which is available from good companies and which is irradiated and which is cleaned very thoroughly, that there is no infection and inflammatory cells in it, and then put it back into your bone, and we will make the bone back and put the soft tissue covering out or the gums back. Then your tooth will be fine. Otherwise, what we can do is reduce the length of the tooth so that it doesn't give you much of a shaking, because if your length is more, it will start shaking more. Then how is it done? It is done using a flap surgery. The gums has to be opened up. We need to clean all what is there around the tooth, or you will have calculus or the plaque which is there inside. This is what is giving you gingivitis, and after that giving you periodontitis or the gum diseases. So you need to remove it, and then you need to clean the whole area, put new bone there, make bleeding so that it becomes more and more close to the bone and the tooth, and then close the wound so that it doesn't the oral fluids doesn't go inside, and then wait for it to heal. Once that heals, then you will have a very good dentition back. Brush your teeth twice daily, that is morning and evening. I always suggest that you should not go and get up and go and do a brushing. As soon as you get up, you just walk into the bathroom, then go. That is not the way you have to do. Just go wash, take your breakfast, finish everything, then go and brush and go to your office. Then after you come back, take your dinner, take your whatever you want to have, finish everything, brush, then you go to sleep. Okay. Or if you do that, you will not have food debris which is there in your gums or on the tooth. So you will not have infections around the gums or on the tooth, just like it is. So the most important aspect about gum diseases is that take care and you will not lose anything. Thank you.